Hey, how are you doing? So today we are going to discuss the skeletal system together with the musculoskeletal system. So the part 1 will be discussing the skeletal system. Introduction. The skeletal system of an adult human consists of 206 bones and the associated cartilages. The bones are supported by ligaments, tendons, bursae, and muscles. So the bones are divided into two distinctions. The axial skeletal includes the bones along the long axis of the body. The axial skeleton consists of vertebral column, bones of the head, bones of the thoracic cage. Appendicular skeleton involves the bones of the pelvic girdle and the shoulder girdle, as well as the bones of the upper and the lower extremities. The bones are specially rigid structure made of calcified dense connective tissue, as we discussed in tissues. Bones tissue is composed of a mineralized bone matrix that consists of type 1 collagen fibers dispersed throughout the ground substance. The cellular component of the bones are represented by three types of specialized bone cells called osteocytes, osteoblasts, and osteoclasts. The bones consist of two distinct layers that differ in histological appearance and characteristics. As we said, we have compact bone and spongy bone. So the compact is the outer, much denser layer of the bone, which gives it its smooth, white, and solid appearance. The outer surface of the bone compact is covered with a layered dense connective tissue called the periosteum. Inner side is covered by the compact bone is covered with the endosteum, which is the boundary between the compact and the spongy bone. The compact, which is cancellous bone, is the deep, airy layer of the bone. Unlike the compact bone, spongy bone is highly vascularized and more metabolically active. It's typically found within the ends of the bone, the long bones, and in the vertebrae. In certain bones, like the hip bones, sternum, or femur, the central part of the spongy bone houses the bony marrow, which is the site for hematopoiesis in adult, which is production of blood substances. This skeletal system helps in support and movement of the body through points of attachment. It serves as point of attachment for muscles, protect the internal organ from injury, like protecting the heart, protecting the brain. Bone cartilages also scaffold supports the rest of the body, like the cartilage is attached to the bone to provide structure and also movement. Hematopoiesis, which is a process of production of new blood cells that are produced in the bone marrow, are red blood cells, platelets, white blood cells such as monocytes, granulocytes, and the lymph nodes. The bone also serves as a mineral and fat storage system, which is important in the function of the body, especially calcium and phosphorus. Classification of bones done classified according to shape, that is long bone, short bones, flat bones. The long bones are cylindrical in shape, being longer than its wide. The term describes the shape of a bone, not its size. So the long bones are found in the upper limbs, humerus, ulnar, radius, and the lower limbs, that is femur, tibia, and fibia, as well as the middle metacarpals, phalanges, and the feet, metatarsals, and phalanges. Long bones function as a rigid bars that move when muscles contract. Short bones are cube-like in shape, being approximately equal in length, width, and thickness. The only short bones in the human skeletal are in the carpals of the wrist and the tarsals of the ankles. Short bones provide stability and support, as well as some limited motion. Flat bones, on the other hand, are mysomas, because although a flat bone is typically thin, it is also curved. Examples include the cranial bones, scapulae, the sternal bones, and they offer attachment of the muscle sometimes and protect internal organs. We continue. Irregular bones. This does not have any easily characterized shape and therefore does not fit any other classification. These bones tend to have more complex shapes, like the vertebrae that supports the spinal cord and protect it from comprehensive forces. So we have also some other irregular bones, like the zygomatic bones and jaw bones. There is the jaw bones that are classified as irregular. Sesamoid bones, example the patella, they are small round bones that forms in the tendons. That is makes them be called the sesamoid bones. So patella is one of the largest sesamoid bone in the body. Bones are also they can also be classified according to the region that they are. There are different bones categories according to their region. So we have appendicular bone, the bones of the upper and the lower limb. We have the axial bones with their skull bone, spine bone, the rib cage, hyoid bone. The skull bone are divided into two: visceral, cranial. These are bones of the face. The neurocranium, these are the bones, facial bones. The bones of the skull, neurocranium, sorry. So the facial bones and the neurocranial bones, they are total of 14 bones, and they include the nasal bones, which are 2. Facial bones, there are 14. The nasal bones, there are 2 left, right. Lacrimal bones, there are 2 left, right. Inferior nasal bones, there are also 2 left, right. Palatine bones, there are also 2 left, right. Zygomatic bones, there are also 2 left, right. Maxilla bones, there are also 2 left, right. And the mandible bones is 1. Vomer bone is the middle part between the inferior nasal concha bones. Neurocranial bones, they house the brain. They are divided into 2: calvara and cranial base bones. So calvara bones, they form the cap of the neurocranium. The skull base forms the neurocranium. Some of the bones in the skull bones are part of the bones in the calvaria. So the skull bone is made up of 8 bones. That is frontal bone, which is 1; parietal bone, left, right; temporal bone, which there are 2 left, right; occipital bone 1; ethmoid bone 1; sphenoid bone 1, plus the 14 bones of the face. They add up to 22 bones. So there are different features of the skull bone that differentiate it from the human bone. Like the skull bone are wider, has fontanelles that crosses at different age. Like anterior fontanelle crosses at 18 months, posterior fontanelle at 2 to 3 months, anterolateral and posterolateral fontanelles. So the fetal skull doesn't have teeth and has cartilage at the skull base. We have congenital anomalies of the skull. We have craniostenosis, that is early closure of the suture, which is more common in males, resulting in scaphocephaly, wedge-shaped skull due to early closure of the sagittal suture. Most common type under oxycephaly, acrocephaly also, due to bilateral early closure of the coronal suture. Plangiocephaly, twisted skull due to early closure of coronal or lumphoid suture on the one side. You can have some pictures here. Scaphocephaly, oxycephaly, and plangiocephaly. So vertebral column, also called spine, has 33 bones made up of vertebral bones, vertebral discs, vertebral ligaments. The vertebral bone, the cervical bones are 7 from C1 to C7. The thoracic bones are 12 from T1 to T12. Then the lumbar bones are 5 from L1 to L5. Then sacral bones are also 5 from S1 to S5. We have coccyx bones, which are fused from 1 to 4. We also added ligaments under this. We can discuss about the curvatures, the vertebral curves, the curvatures. There are two. The primary curvature scaphoid, which present during fetal development. Then secondary curvatures lordotic, which form after delivery. So concave posterior is the normal one. Then we have cervical curvature, which has both secondary and lordotic curve, that is C1 to C7 curvature. Then you have convex posteriorly thoracic curvature, that is T1 to T12, that has both primary curvature. So the cervical curvature has a secondary curvature, the thoracic curvature has a primary curvature, is kyphotic curvature. Then concave posteriorly, it is lumbar curvature that has secondary or lordotic curvature. Convex posterior, still on the sacral, we have sacrosigil curvature, which has the primary curve. We have some abnormalities like spina bifida, we have hemivertebrae, we have sacral agenesis, and clipal fail malformation on the spinal vertebrae. Finally, we will be discussing the human rib cage anatomy. The human rib cage is bony structure that protects vital organs in the thoracic cavity, such as the heart, lungs, and plays a crucial role in respiration. It's made up of the ribs, sternum, thoracic vertebrae, and the cartilages. Humans normally have 12 pairs of ribs, making a total of 24. Ribs are categorized into three main types. So true ribs are 1 to 7, and the true ribs attach directly to the sternum via the costal cartilage. Then you have false rib, that is 8 to 10. These ribs do not attach directly to the sternum. Instead, they connect to the cartilage of the rib above. Then you have floating ribs, 11 to 12. These ribs are not attached to the sternum at all and end at a free and are free at their anterior ends. You can just see them, floating ribs. We have false ribs, have true ribs. So true ribs are pairs 1 to 7. False ribs, they are pairs 8 to 10. Then pairs 11 to 12, they are the floating ribs. The sternum, also known as the breastbone, is a flat bone located in the center of the chest, anterior side of the chest. It consists of three parts. We have the manubrium, which is the upper portion that articulates with the clavicles and the first pairs of the ribs. We have body, the long central part that connects to ribs 2 to the 7th pair. The first pair is articulated by the manubrium. Then the body articulates pairs 2 to the 7th pair of the ribs. Scaphoid process, small pointed lower part, which can vary in shape and size. Then you have vertebral. I'm discussing thoracic vertebrae because the ribs cage is attached to the thoracic vertebrae T1 to T12. So all of the T's are attached to the thoracic vertebrae when I'm discussing it. Okay. The costal cartilages, these flexible cartilages connect the ribs to the sternum, allowing for expansion and contraction during breathing. Congenital malformation of the sternum, we have pectinus excavatum, and that is a funnel chest or sunken chest. You can see it here. The breastbone and several ribs grow inward, creating a significant depression in the center of the chest. This is most common type and can put pressure on the heart and lungs in severe processes. That is pectus excavatum, pectus carinatum, pigeon chest or raised chest. You can see in this image. The breastbone and ribs protrude outward, giving the chest bird-like appearance. This condition is often treated with a corrective brace rather than surgery. Hyoid bone for muscular attachment and found at the larynx. So you can see it. So that was the appendicular skeleton are divided into two. the upper lower limbs and the upper and lower limbs. The lower limb has pelvic girdle, femur, patella, tibia, and fibula. Then we also have the bones of the foot. We also have the upper limb that has pectoral girdle, humerus, radius, ulna, and the bones of the hand is palm. And as you can see here, the pelvic girdle has, shoulder girdle has the clavicle, scapula, humerus, ulna. It also has radius and carpals, metacarpals, phalanges. The leg has, the lower limb has the pelvic girdle that has 3 bones. There's 2 bones with 3 portions in each bone. There's a 6. Then has the femur, patella, tibia, and fibula, and the tarsals, metatarsals, and the phalanges. So pectoral girdle made up of the clavicle and scapula. The pelvic girdle is made up of the ilium, ischium, pubis, both on the right and the left. The tarsals, the carpals here, the first image, is made up of the scaphoid medially. Is made up of the scaphoid, trapezium, trapezoid, and laterally we have the pisiform and also triquetral bone. Capitate and hamate, they are found on the middle part, and also lunate. So it adds up to 1, 2, 3, 4, 5, 6, 7, 8 bones of the carpals. Then metacarpals is made up of 5 in each arm, so it adds up to 10. The phalanges, there are total of 14, so it adds up to 28 bones. Sorry, 7, then it's add up to 14 bones. Okay. The foot bones. Laterally we have cuboid bone. Medially we have cuneiform bones that are arranged from medial to lateral. Have medial cuneiform, intermediate cuneiform, lateral cuneiform. Those are the 3. Then inferior to medial and intermediate cuneiform, and also lateral, we have navicular bone, and also we have talus bone on top of the navicular, then calcaneus behind it. So it adds up to 7 bones plus the 10 metatarsals plus this 14 phalanges. It adds up to 26 bones.